Hi everyone, welcome back to my YouTube channel and today we are going to talk about Kaposi Sarcoma. So let's start the topic with introduction. Kaposi Sarcoma is a vascular tumor of endothelial origin that is caused by human herpes virus 8. It is low to intermediate grade malignancy that is often associated with immunosuppression, particularly HIV or AIDS. Kaposi sarcoma can involve the skin, oral mucosa, lymph nodes, and internal organs. The oral cavity is common site for early manifestation, especially in immunocompromised patients. Definition of Kaposi sarcoma. Kaposi sarcoma is defined as a malignant muscular neoplasm that is characterized by proliferation of spindle-shaped endothelial cells, formation of irregular vascular channels, and extravasation of red blood cells and deposition of hemosiderin, often linked to human herpes virus 8 infection. Etiology. It is caused by human herpes virus 8 and it is necessary for tumor development, while oncogene promote proliferation and angiogenesis. Second etiology is immunosuppression, that is because of HIV or AIDS, that is classic AIDS-associated Kaposi sarcoma, and it also caused by organ transplant recipients on immunosuppressants. Third etiology of Kaposi sarcoma is genetic and environmental factor, as there is familial clustering in some population and there is male predominance. It is higher incidence in Mediterranean and African and Middle East population. Other risk factors for Kaposi sarcoma include older age is the classic Kaposi sarcoma and chronic inflammation and immune dysregulation. Pathogenesis. Kaposi sarcoma arises due to viral infection and immunodeficiency, leading to abnormal endothelial proliferation. First, there is human herpes virus 8 infection. It infects endothelial cells, B cells, and monocytes. Viral protein activate VEGF, that is vascular growth factor, that promote angiogenesis. It then inhibition of the apoptosis that allow abnormal cell survival. And second, there is immunosuppression, that is reduced immune surveillance that permits viral-driven proliferation. HIV protein further stimulate angiogenesis. Third, pathogenesis is formation of vascularization, that is proliferation of endothelial cells from spindle cell clusters. Blood extravasation lead to purplish red lesions, and then there is chronic inflammation that promotes tumor growth. Clinical features. First, there are skin lesions that are most common presentation. They are purplish red, blue, or brown macules or papules or nodules or plaques that are usually painless but can ulcerate in advanced disease. They can coalesce into larger masses. Then there are oral lesions that are early manifestation in AIDS-related Kaposi sarcoma. Its common sites include hard palate, gingiva, and tongue. Its lesions are purple or reddish nodules that are sometimes ulcerated. They may interfere with speech, swallowing, or mastication. Then there are systemic symptoms that are rare in early stages. They include weight loss, fatigue, and anemia in disseminated diseases. Now let's talk about types of Kaposi sarcoma. First is classic Kaposi sarcoma, that is slow growing and it is mostly in elderly men with in the lower extremities. Second type is endemic or African Kaposi sarcoma, that is aggressive and it involves younger patients with may involve lymph nodes. Third type is epidemic or AIDS-associated Kaposi sarcoma, that is rapid, widespread oral and skin involvement. Fourth type is heterogenic or immunosuppression associated Kaposi sarcoma, that is at the post-transplant patient. Histopathology of Kaposi sarcoma. There is proliferation of spindle-shaped endothelial cells and formation of irregular slit-like vascular spaces. There are extracted red blood cells and hemosiderin deposits, and there are chronic inflammatory infiltrate. Immunohistochemistry show HHV8 positive, CD31 and CD34 positive. Diagnosis. First we do is clinical assessment that involves observation of purplish red lesion, that is check for immunosuppression like HIV test and CD4 count. And second we can do for diagnosis is biopsy that confirms spindle cell proliferation and vascular channels. HHV8 immunostaining is also done to confirm viral etiology. At third, we can do imaging that may include CT or MRI for internal organ involvement, and endoscopy is may be done if gastrointestinal lesions are suspected. Differential diagnosis for Kaposi sarcoma. There are pyogenic granuloma. It should be differentiated from this. It should be differentiated from hemangioma, angiosarcoma, oral melanoma, and blue nevus. Management of Kaposi sarcoma. First, we treat underlying immunosuppression, that is to initiate or optimize antiretroviral therapy in HIV positive patients, and reduce immunosuppressant if post-transplant Kaposi sarcoma is there. Second, we do is local therapy, that is surgical excision for small lesions, and cryotherapy or laser therapy may be done. Intralesional chemotherapy may be done, and we can also then we go for systemic therapy that include chemotherapy for widespread disease, interferon alpha in selected cases, and we can also do radiation therapy that is effective for localized lesion, and it is commonly used in older patients with classic Kaposi sarcoma. Prognosis. Classic Kaposi sarcoma prognosis, as it has slow progression, so its prognosis is generally favorable. AIDS-related Kaposi sarcoma prognosis depends on immune status and ART response. Disseminated Kaposi sarcoma has poor prognosis, especially with visceral involvement. Complications in Kaposi sarcoma. Lesion ulceration and secondary infection may happen. There may be bleeding from oral or skin infection. There is difficulty eating, swallowing, or speaking if oral lesions are large. And there are cosmetic and functional deformity and organ failure in disseminated diseases. Prevention of Kaposi sarcoma. Early detection of HIV and initiation of ART. Regular oral examination in immunocompromised patients, and minimizing immunosuppressive therapy where possible in patients can prevent Kaposi sarcoma. Conclusion of this lecture video. Kaposi sarcoma is a vascular malignancy that is linked to HHV-8 infection that predominantly affect immunocompromised patients, including those with HIV or AIDS or transplant recipients. Oral radiation often provide an early clue to systemic disease, and management relies on treating immunosuppression, local lesion control, and systemic therapy for advanced diseases, with prognosis depends on disease type and immune status. And this was all about Kaposi sarcoma. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.